let's start with somebody who was really struggling initially making these changes and why it might take the body a little bit to adapt, a little bit of time. This is from Be Kind, who writes, I'm glad that Dr. Fuhrman talks about feeling crappy when swapping out to this way of eating. I've been doing a whole food vegan diet now for about 3 to 4 weeks, and I just feel like yuck. That's what they say. So 3 to 4 weeks to get over the hurdle for this person. They're still kind of in the doldrums. How long do you think it could take as somebody kind of detoxes off of their old way of eating and gets pumped up with the whole food plant-based?
Well, keep in mind that most people take a week, not 3 or 4 weeks. Okay. They usually feel ill for the first week. And we're also usually cutting the salt out of their diet too. Because salt exacerbates autoimmune conditions and allergies, for example, and headaches. But of course, it's a leading cause of death, especially among causing both accelerating the risk of both hemorrhagic stroke and ischemic or embolic stroke. But in any case, what I'm saying right now is that when you're coming off from a high salt diet and moving to a low salt diet, your kidney still thinks you're on a high salt diet, and that takes a month. Mm-hmm. So the kidney, you're taking in less salt, but the kidney is still overly removing salt, and you're not taking it in, and you're going to be hyponatremic, or your levels of sodium could be too low. What I'm saying right now, some people, when they drop their salt intake down, the body's still sweating out too much salt and urinating out too much salt. And when you do that, you don't just urinate out salt, you take out chloride and phosphorus and magnesium and potassium, so your electrolytes get too low, keeping them chronically fatigued. Right. And what exacerbates that, if people overly drink water, they don't use much water now, but if they overly drink and are drinking the amount of fluid they required on the high salt junk food diet, like 8 to 10 glasses of water a day, and they're drinking 10 glasses of water a day on a low salt diet, and the body hasn't acclimated yet. It could take 4 to 6 weeks for the kidney to stop excreting electrolytes. Right. And now that over drinking, she could be electrolyte deficient, hyponatremic, and be chronically fatigued. So we can probably address that and fix it. A person should not feel detox for a whole month. However, as the cells and nutrient levels start to increase, it could happen between month 4-week and 12-week period where a person has what happens we call a secondary detox crisis. It means that the body got nutrients in now. It's actually getting healthier. It'll do some deeper cleaning in trying to do some repair it couldn't do before, and maybe you'll feel a little flu-like or a little fatigue or a little skin itchy or something or a little sore throat that could arise, when you're doing this a month. And that's good or a little headachy, and that's good to reflect that, because these mild symptoms of inflammation are expressions that are examples of the body excreting waste products. These are extraordinary means of the body removing waste through channels that it doesn't normally use. Skin, lungs, or an asthma attack is a way of excreting waste through the lung. Headaches, because people view, let's say, something like a headache, something to suppress with a drug, but the headache itself is right-directed. It's toxins and being mobilized for removal. And if you start taking drugs to push it back in, you're going to develop chronic headaches now. Mm. Instead of getting sleep and eating right, and so we're talking about respecting the body's symptoms to see if they're right-directed, or there's still something you're doing wrong that could be exacerbating this. It shouldn't be continuing the person feeling so rotten.
Could a person's size from where they're starting from also dictate how long this process takes? If they've got a lot of weight to lose, could that slow down the detox process?
Yes. And also there could be some more retention of metabolic and xenobiotic wastes. Xenobiotic waste means all types of waste, could be even drugs. And what happens is that the side effects of drugs are enhanced when people get healthier. As you lose weight, as you're eating healthier, you might now start to see you have what you were thinking, this blood pressure medication, this diabetic medication, this headache medication, this pain medication. You're going to experience more side effects because your body's going to lose its tolerance for the waste products. And so the drugs work because they're poisons, because they're toxins. So the toxicity of the drug is, you could say, is part of the efficacy of the drug. It's working because it's toxic. So the drug becomes more concentrated, your body mass becomes lower, your body becomes more sensitized to toxins and put more effort into removing toxins, and you get more drug-related symptoms or side effects.